Let's talk exercise and pregnancy. So there are a lot of misconceptions about exercise and pregnancy, but the main thing I want you to take away from this video is that just because you're pregnant doesn't mean that you're made of glass. You can still be active, you can still stay in good shape, and I can guarantee you, you will feel much better if you do. In fact, something that I've joked about with people is that if I were to draw a picture of myself and how I feel at 6 months pregnant, I might draw a tiny bump. I wouldn't draw the bigger bump that I actually have because I've been so active and I've stayed in shape and I've been feeling good the whole time. I don't feel like I'm carrying a lot of extra weight around, and I'm kind of surprised when I see pictures of myself or catch my reflection. So you can feel really, really good by making sure that you stay active and you exercise in pregnancy, and that includes pain management, because you're gonna feel a lot better in terms of upper back pain, lower back pain, and pelvic pain if you do the right stuff. So the first thing I want to talk about for keeping exercise safe during pregnancy is the talk test. And this is generally considered more valid these days than using a specific heart rate, because think about it. Pre-pregnancy, heart rates can vary widely based on how fit you are and your individual makeup. And then when you get pregnant, your heart rate changes anyway. So in some ways, that's not really a valid measure compared to, are you super, super hot? And would you have difficulty maintaining a conversation? If either of those two feelings strike you during a workout, it's probably time to take a break and or just slow down. But if you can carry a conversation and you're not overheated, you're probably fine, even if you're a little out of breath and you feel like you're pushing yourself. Number two, let's talk about that idea of pushing yourself. Yes, push through lethargy, push through inconvenience, push through mental discomfort, but absolutely never push through physical discomfort or pain. If you feel a twinge or something really uncomfortable, your body's sending you a signal saying to stop. Pregnancy can bring up a whole new range of sensations because when you're pregnant, your ligaments loosen, and that includes ligaments in weird places like the front of your abdomen or in your pelvis. And in fact, I saw one practitioner demonstrate with a pelvis, like a bony model, that it moves like while you're walking and while you're doing strength training, it moves within itself. So it's different than when you're not pregnant. You have to take special precautions and you have to listen to your body to make sure you're not pushing through something that's genuinely a red light saying stop. The third thing I want to talk about is the concept of Diastasis Recti, which is the separation in the front of the ab muscles that happens to many, many women in pregnancy. It's very normal. The way to help prevent it from getting too bad or being too severe is to be really careful with how much pressure you're putting on your core. So you definitely need to cut out exercises like crunches, but what a lot of people don't realize is you should also cut out exercises like full planks, because it creates a lot of pressure in the front of the core, even if you're not curling up like you would with a crunch. So I recommend replacing those exercises with lots of hands and knees exercises, but then also doing some more side exercises. So think like side planks, maybe from the knee, a shorter angle, or windmill exercises, which I'm going to show you in the rest of this video. But do cut out exercises that involve a lot of abdominal pressure, which could even include things like heavy pull downs or pull-ups, heavy overhead presses, anything where your core is really going to engage tightly. We don't want to do those. And finally, let's talk about listening to your body, because in pregnancy, there will be times when you feel tired, there will be times when you don't feel like working out, and it can be a really fine line in figuring out what are those times where you need to override maybe what is a little laziness and could have happened even before you were pregnant, and not overriding something that is a natural signal to slow down and take it easy. And I honestly think this takes practice, but you need to get really good at listening to your body signals of, I've had enough, this is too much, I need to switch activities, this is uncomfortable, all of those things that go way beyond just like mental discomfort, and it's really your body telling you, hey, you need to take it easy, you need to take a break. So all of that combined can make you have really, really good exercise habits while you're pregnant, which is going to help you feel so much better in terms of your energy, your sleep, your digestion, your appetite, and a lot of those pesky aches and pains that a lot of people get in pregnancy. You're going to manage all of that so much better. So let's take a look at what exercises are going to make a really big difference for you in pregnancy. And keep in mind, I'm not just talking from personal experience. I am a personal trainer and I also have a pre and postnatal specialization. So I'm talking about what I've experienced in pregnancy, but please know it's backed up by science and by education. So I know the right things that you can do to help yourself feel better, and then you can listen to your body, experiment with things, and decide what's the best thing for you.